Welcome to this explainer. Today, we are taking on a truly massive public health puzzle. Our goal is to completely demystify dengue fever. We're going to break the whole thing down, taking you all the way from a microscopic, buzzing threat right up to the latest global clinical guidelines used to treat it. So, let's just dive right in.
400 million. Just let that sink in for a second. That is the staggering estimated number of dengue infections that happen worldwide every single year. It's a massive figure, and it makes dengue one of the most significant mosquito-borne viral diseases on the entire planet. The stakes we're talking about here are truly immense, especially if you look at tropical and subtropical regions across Asia, Latin America, Africa, and the Pacific Islands.
So here is our roadmap for today. We'll start with the global threat and the villains behind it. Then we'll go inside the human body to track the patient journey, followed by how to spot the crucial warning signs. After that, we'll tackle diagnosis and treatment, and we'll wrap things up with prevention and protection.
All right, kicking things off with Section 1, the global threat and the villains.
So the primary vector, basically the carrier of dengue, is the female Aedes aegypti mosquito, and a bit less commonly the Aedes albopictus. She goes through a standard life cycle: egg, larva, pupa, and finally adult. But what makes her such a formidable villain? Well, surprisingly, she actually exhibits a really unique daytime biting behavior, meaning you aren't just at risk at night while you sleep. And crucially, she absolutely loves urban environments. She thrives breeding in tiny, small pools of standing water right in the middle of densely populated, bustling cities.
But the mosquito is really just the delivery system, right? The true villain is the dengue virus itself, or DENV. It's an RNA virus that belongs to the flavivirus family. But here is the critical part you need to know. It actually comes in 4 main serotypes: DENV 1, 2, 3, and 4. Getting infected with one serotype doesn't give you full immunity to the other 3, and this sets up a fascinating but honestly highly dangerous immunological trap inside the human body. It's a phenomenon called antibody-dependent enhancement, or ADE for short. Basically, if you recover from DENV1, you now have antibodies against it. Great, right? But if a mosquito later infects you with DENV2, those existing antibodies don't actually neutralize the new virus. Instead, they act like a Trojan horse. They accidentally bind to the new virus and literally help it enter your immune cells more efficiently. So the really crucial takeaway here is that a second infection with a different serotype significantly increases your risk of severe disease. It's quite literally the virus weaponizing your own immune system against you.
Moving right along to Section 2, inside the human body, the patient journey.
Every healthcare provider treating dengue is basically watching a specific chronological timeline. The patient journey is divided into 3 very distinct clinical stages. First up is the febrile phase, which lasts about 2 to 7 days. Next comes the critical phase, and finally, the recovery phase. Now, understanding this timeline isn't just some academic exercise. It dictates exactly how a patient is going to be medically managed.
During that first stage, the febrile phase, the patient experiences a really high fever, a severe headache, and something called retroorbital pain, which is this intense, deep ache right behind the eyes. Also, take note of the muscle and joint pain. This can be so incredibly debilitating that dengue actually earned the famous nickname breakbone fever. You add in a skin rash, nausea, and vomiting, and you can imagine it's just an incredibly miserable experience for the patient.
Now, naturally, you'd probably think that when the fever finally settles down, the worst of it is over, right? I mean, that's how most flus work. But what actually happens when a dengue fever finally breaks? This is the most counterintuitive and dangerous part of the entire illness. The fever breaking is exactly when the true danger begins. And that brings us to Section 3, spotting the warning signs.
As that fever finally subsides, the patient enters the critical phase. The body's intense immune response and inflammation cause the blood vessels, specifically the tiny capillaries, to actually start leaking blood plasma. At the exact same time, there's a rapid destruction and sudden fall in the patient's platelet count. If this plasma leakage is severe enough, it leads to shock, organ dysfunction, and a terrifying condition known as dengue shock syndrome. Because of that rapid decline, we absolutely need to memorize the emergency warning signs that tend to pop up just as the fever drops. We're looking for severe abdominal pain, persistent vomiting, any bleeding from the gums or nose, blood and vomit or black stools, difficulty breathing, or extreme weakness. If you or a loved one show any of these red flags, and this is especially true for vulnerable groups like kids, pregnant women, or older adults, it requires immediate hospital evaluation. Literally every single hour counts. Let's transition into Section 4, diagnosis and treatment. First off, doctors have to make sure what they're looking at is actually dengue. In a lot of tropical regions, patients come in with a fever, and honestly, it could be a number of things. So clinicians use differential diagnosis.
Dengue is marked by that intense breakbone pain and a high bleeding risk. Malaria, on the other hand, presents with cyclical fevers and is actually caused by a parasite, not a virus. And then there's chikungunya, which is very similar to dengue, but typically features even more severe, long-lasting, debilitating joint pain.
Once dengue is suspected, timing is literally everything for the lab work. In the early phase, meaning those first few days of fever, doctors will use the NS1 antigen test, or a PCR, to detect the virus itself in the blood. In the later phases, the virus actually clears out, so those tests won't work. Instead, tests look for the body's immune response, the dengue IgM and IgG antibodies. And right alongside this, doctors are constantly monitoring a complete blood count to watch for rising hematocrit, which essentially indicates the blood is thickening from that plasma leak, and they're watching for plummeting platelets.
Now, here's a sobering fact. There is absolutely no specific antiviral medicine approved to just cure dengue. However, rigorous medical management and supportive care absolutely save lives. It's all about very careful IV fluid management to counter that plasma leakage, plus close monitoring of vitals and urine output. But I want to draw your attention to a massive vital WHO guideline. You must strictly avoid all NSAIDs, things like aspirin, ibuprofen, and diclofenac. Because dengue already destroys platelets and skyrockets your bleeding risk, taking ibuprofen can actually trigger a fatal hemorrhage. Always use paracetamol or acetaminophen for the pain and fever.
Let's see how this actually plays out in the real world. Imagine a child coming into the clinic with warning signs, like severe abdominal pain. Step 1. They are immediately admitted for monitoring. Step 2. Judicious, highly calculated IV fluids are administered to maintain their blood pressure without overloading their tiny system. Step 3. Their hematocrit and platelets are tracked meticulously by the hour. And Step 4. With this incredibly careful support bridging them safely through that critical phase, the leaking eventually stops, the fluid is reabsorbed, and they enter a gradual recovery. This structured, careful protocol is exactly how doctors win the fight against dengue.
Finally, we reach Section 5, Prevention and Protection. Because the Aedes mosquito breeds so easily in urban environments, eliminating standing water in pots, old tires, and gutters is far and away our #1 defense. It just cuts off their life cycle entirely. You add to that mosquito nets, window screens, and insect repellents for personal protection. On a larger scale, community indoor spraying really helps control outbreaks. And excitingly, there are now actual dengue vaccines available for specific eligible groups based on national guidelines, which offers a really powerful tool for long-term protection in areas where the virus is endemic.
As we wrap up this explainer, I want you to remember this core takeaway drawn directly from global health guidelines. Early recognition of warning signs and appropriate supportive treatment significantly reduce the risk of severe disease and death. Dengue can be absolutely terrifying, especially when you know about the Trojan horse effect of a second infection, but it is highly manageable when we use the structured knowledge we just went through. Which leaves us with this final thought. Are you prepared to spot the warning signs and protect your community from dengue? Because now that you know exactly how the virus works, how the fever breaking is actually a false dawn, and why NSAIDs absolutely must be avoided, you really have the tools to make a difference. Take this knowledge, apply it out there, and stay safe. Thanks so much for joining me on this explainer.